This is a presentation we actually did to our NIHR colleagues, so the funders, and we had a session explaining our research to other people with a similar funding projects, which are public partnerships, sort of innovative public partnerships between NHS, voluntary sector, and researchers or academics. So we're being funded by the National Institute for Healthcare Research for this project, which is quite exciting. They're saying that co-production is this brand new thing, and we're sort of saying, oh, we've been doing it for a long time. And organisations like Contact, and I imagine like yourselves, have been working in partnership together, voluntary sector and with statutory organisations. So it's exciting and new in some ways, but not in others. Oh, hang on. Am I still on?
We've just lost your presentation, Mary. There we go. It's coming back. There you go.
Okay. Yep. There we go. So the model we're using, just in terms of the sort of context to share with you, is the Lundy model, and that is about it's been developed to support child voice and work with children to give equal weight to children's voice in decision making around, you know, for children to have a voice in participation in decision making. It's used by the Government of Ireland. It's used by the European Union. So it's a well-established model that you might have seen. And that's about space, creating space for children to be heard. We're also, when we talk about voice, we're talking about parents. So we are using this model and applying it to the way that we work with parents and with families. So about voice and audience and influence are important. So it's about actually not just having a voice, and sharing that voice, but actually something being done as a result to this impact. So we need to be able to show that as we go. We want to engage differently, and we are working to support and recognise difference and in this, what we call intersectionality. So whilst this is a project about access to healthcare and how families are experiencing their access to healthcare, we recognise that a lot of the kind of social and interpersonal aspects really matter. So we want to build trust, we want to be open and listen and challenge each other as a group and as the way we work. So we are open to your thoughts and challenge today, and really interested in what you think. And we want to make our research accessible to families. So if families have low literacy levels, if families prefer video to reports, then we want to, you know, respond to that and make sure that what we come up with is going to be useful, and actually the content, the materials that we're using as we go are accessible to families. This, sorry, lots of words on one page, but if you just get the sense, the structure of what we're doing. So we've got various organisations involved in the project. We are looking at access to healthcare in the Northwest. And when we say healthcare, we mean all healthcare, and that's obviously quite a broad. So we're talking about dentists, doctors, GPs, hospitals, mental health community, you name it. And obviously it's as defined by families and by children, so that's important. We've got a steering group who are overseeing the work, and that includes some strategic leadership. So we've got DCOs on that steering group. We've got Steve Kay, haven't we, from Rochdale on the steering group. So it's great to have that Northwest focus and leadership. We've also got Stuart Dunn from Northwest Youth Focus. So we've got that. He represents, as it were, the young people that he works with. So we've got some youth voice, although not directly, and that's important that we acknowledge that, and also have some youth voice in what we're doing. So we've got the core project team, Joanne Alder. We've got our Edge Hill University, and Lucy Bray is our professor leading with us, and obviously Joanne spans the Edge Hill and also Alder. And so we've got health. And for Contact, we are a voluntary sector organisation. We represent and work with families. We provide advice and support to families, and we support families to help each other. So really around SEND, around children's needs, but around that, how we connect and support families. Then the next layer, we're working with the Northwest Parent Care Forums, who are embedded in their parent-led organisations around the Northwest in each locality, and they have a role to work with statutory partners. So you've got one in Rochdale, who I imagine you work with. I don't know if there's anyone here today. I don't think anyone's from the forum today, but Kath Bromfield's been working with us, and she's connected closely with the forum. So we're working now to look at families' experiences from 3 separate communities. And when I call these communities, they are within themselves very diverse. So we're bunching people together here, but we recognise that within these boxes, there's lots of diversity. So when we spoke to parent carer forums, we are in July, back in July, wasn't it, Joanne? We asked them what is it that creates barriers that prevents families from accessing healthcare in their experience, and they have lots and lots of families who come to them and ask for help for their child with special needs, with neurodiversity, with disability, and they said, okay, these are the groups who we think are perhaps the most excluded or struggle the most to get the healthcare that they need. So we could have done it in a different way, but this is the way we did it. We wanted to involve families and parent carers to tell us where we should start the project. So we're looking at Gypsy, Roma traveller families, we're looking at refugee and asylum seeking families, and we're also speaking with parent carers who themselves have a disability or neurodivergence and have a child with a disability or neurodivergence. So those are the 3 groups that we have chosen to work with. And I can go into a bit more detail about how we're doing the work and what we're planning to be doing. But that's kind of where we are, isn't it, Joanne? Because it's taken...
Yeah, it is. And importantly, the NIHR were really keen around the Gypsy Roma traveller communities, because we know very, very little about the needs of young people with neurodiversity and disability. So they were very keen for that. We know why now, because it is a really difficult piece of work, but really, really we're learning lots, aren't we, Mary? But yeah, so they're the 3 communities we're focusing on, and Mary's absolutely right. We've generalised there, and apologies again for the language. The language is really clunky here. But yeah. Have we got another slide, Mary?
Yeah, so I'll go to the next slide. So this is just describing our research process, and we've done lots of work around scoping and just trying to map out who are the organisations and who work with those communities, who are the trusted people who work with those communities, and then reaching out to those individuals and organisations. So obviously Rochdale and yourselves in Action Together have been really supportive of the project. And we're working together with, so Will and Lauren at Rochdale Council are supporting us to connect with some young people and also some parents and families in the traveller communities and Roma Gypsy communities. And also Juice, who is Juice Ramosi. I don't know if any of you have come across Juice. He's a Rome man. If I got that right, Roma. So he's from the Roma community himself, and he is very well connected to a variety of different groups within that community across the Northwest. So he's supporting us to have conversations, and very initial tentative conversations at the moment with hopefully with 1 or 2 families in that community to help us design the programme. The idea is that we work with individuals who are embedded and trusted in communities to design how we ask questions. So we're not yet at the point of gathering data, but we'll come to that. So that's sort of next year. In the new year, we'll be doing that listening, learning, so phase 3, and actually beginning to have those conversations about, what are the barriers, what's preventing or stopping you from accessing healthcare. What does it feel like when you go to the dentist or doctor for your child and for yourself? Because some of those barriers are kind of layered, aren't they? And we talk about intersectionality, but it's the reality of that and what that means. And then we want to make sure that when we report, that the language we use and the findings that we come up with, that we test those back with the families and with the communities, and that we check that we've got the right messages. and that we're delivering those messages in the right ways, in the right formats. So we're going to have a process of testing back over the summer next year so that we can close, hopefully by September. It's challenging.
So yeah, thanks, Mary. So we're at the phase 2 reaching out, which is part of this now, around making those sort of allegiances with people who know some of these community groups and who can put us in the right direction. So fundamentally, as Mary said, we didn't set the agenda. We were quite surprised that we received this funding because we said we don't know what we need to look at until we ask people what their priorities are. And we don't know how we'll do that until we ask people how they want it done. So we sort of put it in thinking this is actually not going to get the funding because it's not specific enough. But actually, we're delighted we have got the funding. So we're at that reaching out phase, and you guys are part of this. What is it we need to be thinking about, and how is the best way to do it for those communities? How do we phrase it? How do we frame it? So this is what we're interested in at this point, is trying to get that information back off you guys who might know the best way to approach this, the best language, and actually what the families might want or need, and then making those connections. We are very aware that we might not be the people that people want to speak to. We might not represent people they want to engage with or be using the right language, etc. So we're quite happy to make those connections and support and fund where possible those people to make those connections on our behalf. So that's really where we're at. So it's great that you're with us. There's no such thing as a free Zoom call, is there? That's really where we're at, starting to look at making some connections. Thanks, Mary.
Thank you. And I've got more slides, but I wonder whether I should sort of start, and this is more about the process. And I think, Joanne, you sort of described this actually already. So, we're really kind of beginning that, we're doing that reaching out, and then obviously the data collection will follow. But those are really conversations with individuals. So we might do interviews with individuals, with the parent carers with neurodiversity and disability. Because we work with parent carers contacts and also in the Northwest Parent Carer Forums, we've got quite a good connection. So we can have Zoom calls like this. We can reach out to parents who are already in our networks, but there's a step further that we can also go to find parents who are not yet in those networks, who maybe wouldn't join a Zoom call, but might come and have a coffee or, talk to another parent. So there are different ways that we can go about that. And we really want to design them based on the needs of those communities. And then, just sort of really thinking about the methods we use, how we are accessible and how we share and how we say thank you. And you guys might have experience of like how best to, say thank you in a way that recognises people's time genuinely, and not just like a £5 voucher and off you go, but just to recognise that people are sharing their stories, and some of those can be challenging to share. So I think that's it for slides. I'm going to come out and
that's great, Mary. Thank you. And just really for us, it feels as if we're as you heard, we're in that listening and learning phase. So any thoughts you've got are most welcome. But also, as I say, no such thing as a free Zoom call. We're looking for those connections, those connectors that might allow us to have those conversations nearer the communities. So we frame it right, do it in a way that's respectful and the way they want to do it. And Mary's right. We'll do Zoom calls. We'll do surveys. We'll do questionnaires. We'll do interviews, will do whatever is most useful for those people who want to engage, because ultimately there's a reason people don't engage with us. We're very mindful of that. So is that okay, Hayley? Is it okay to go over